Good morning, respected faculty members, my seniors and my colleagues. My name is Dr. Shrenuj Gandhi. I am an orthopedic surgeon at Elite Hospital. My case today is popliteal artery injury during total knee replacement. I am about to discuss a case which gave me sleepless night and multiple skip bits but made me a more careful surgeon. I hope it does not happen to anyone though, because it's a nightmare for any joint replacement surgeon. A 62-year-old case, old male patient suffering from bilateral severe OA, posted for right total knee, no comorbidities, pre-op range 10 to 80, distal vascular status pre-operatively was normal. Surgery done under tourniquet, medial parapatellar approach taken, everything was going as planned, range from 0 to 140 achieved on table. Pre-operative X-ray and post-operative X-ray, I don't think anything unusual here. As a standard practice, tourniquet was deflated before closure. There was a sudden gush of blood which was not normal. Blood pressure plummeted to 70/30. I did not understand for a moment what to do. However, I flexed the knee. Bleeding stopped in around 2-3 minutes. BP gradually started increasing. At this point, we suspected that the injured artery was thrombosed. To confirm, we opened the distal draping to feel the pulse, but it was absent. We immediately called the vascular surgeon with handheld Doppler. He could not detect any flow signals. He advised to get a CT angio and plan for bypass grafting. We completed the closure, got the CT scan done. This is how it looked. CT angio showed complete occlusion of around 10 centimeter in popliteal artery, but collaterals were present which kept the limb warm. Standard of care here would have been to get a vascular bypass graft, as the patient would suffer from claudication or rest pain, less likely to go for amputation as collaterals would have saved the limbs. But what if the graft fails? Early graft failures are reported in around 8 to 10% of the cases with autogenous vein graft. Intermediate graft failures are reported in around 20% of the cases. Prosthetic graft has even more failure rates and 5-year survival rates are even less. What would be the consequences then? What does the literature say? There was a paper published in Journal of Vascular Surgery which says that if there is a early graft failure, the 2-year limb salvage rate is only 10%. Another editorial published in Journal of Vascular Surgery says that even if there is acute thrombosis of the graft, it can extend into the collaterals, critical collateral pathways, which can adversely affect the outcome. Another paper published in the American Journal of Surgery says that it should be realized that unsuccessful revascularization attempts may adversely affect healing in those limbs initially considered for BK amputation. Considering the risk and benefits of both the options, that is graft versus conservative, and shared decision making between me, interventional radiologist, vascular surgeon and the patient, we decided to manage him conservatively with anticoagulation and close observation. What was the regime? The regime was Clexane was given 0.6 milligram subcutaneously twice a day for 3 days, followed by rivaroxaban 30 milligram for 21 days, followed by 20 milligram for 21 days, which is the therapeutic dose, followed by aspirin for 6 weeks. Rationale of using rivaroxaban is that conventionally it is thought that anticoagulation works only for venous thrombus, but there have been some papers suggesting rivaroxaban has also effect on arterial thrombus. This is the mechanism how it works. To our surprise, the artery started recanalizing in 3 weeks. Follow-up Doppler at 3 weeks showed normal velocity, monophasic flow. At 3 months, AT and PTA pulse volume was equal bilateral. Patient has no complaint at present, not even claudication, no wound complication, that is God saved. Range 5 to 110, me and patient both are happy with that. This may not be reversible. Failure should always be kept in mind. If the limb is not threatened, conservative management may be considered. These are just the videos. At 2 years follow-up, patient is walking and the limb is...
पगवाड़ो लांबो करो ओके पंजो हलाओ लांबो करो.
On a lighter note, same patient underwent laparoscopic cholecystectomy at my hospital. I could gain his confidence back. Yes, thank you.